Let me give an example. There's an orthopedic hospital in Zuarun. And if you look at it, almost the entire Bawku zone, or the eastern part of the region, and even the entire region actually, we receive all our orthopedic services in that. I think we have a very well structured, as a place there. Now, if you have health insurance, if you were going to pay maybe 4,000 cedis, because of the health insurance component, you are paying 50% of that. I'm just using that to make a demonstration that regardless of the illegalities that is going on, which we are fighting very well, and I'll soon tell you, the illegality that is going on, and we are fighting very well. Being on health insurance is it is a worthy addition. It's a worthy addition to your health, funding, so that you cannot ignore. As I said, if you encounter an accident or a relative encounters an accident and you are going to the orthopedic center, at that time, nothing makes sense to you than to get the survival and the treatment, the speedy healing of your patient. At that particular point in time, if you are supposed to cover that 4,000, it's expensive to go into such situations, 4,000, 10,000, and you see health insurance chopping off almost 50% of that. That alone is a respite to you financially and psychologically, and also help you, stay calm. But when you come to the district level and the service providers in general, charging our subscribers who have active cards is not only an offense, it's criminal, because that is a breach of the contractual arrangement that we have with the service providers. They don't have any right to charge somebody who is coming to seek for that service, for especially the medicines or the services that we have covered. And we have covered, health insurance covers over 90%, 95% I should say, of the diseases or the sicknesses you can think about in this country.
Wow.
So you cannot go to the hospital and say for this particular treatment, health insurance doesn't cover. It is not true. It is for their self-serving purpose and cruel. I call it cruel because you cannot be extorting money from these patients that are vulnerable at your doorstep seeking help and coming to health insurance every month and asking us to pay you claims. So we are seriously working on that. There is something we call the co-payment committee that is established, from the head office, and it has been decentralized to the district office. And if you come here, we have just done some work, going around the hospitals and getting to see evidences of people that are abusing the process and trying to whittle down all the effort that the authority and the government is doing to make sure that we put things right. And very soon, you will see in this district that those who are not complying and those who think that they can still extort money from our people will face the full rigors of our wrath, and maybe they might be facing some sanction, including shutting down their facilities. So we are using this platform as well to tell our people, be confident, know the rules. We have a guide, a book, if you could, one of the books there, that is the handbook for every subscriber. Now, in this handbook, you see, it gives you your responsibilities, your rights, and the things you need to know. That is very, very important in this handbook. So every subscriber that enters our facility, you go out with this. Some, maybe because of the fact that they can read, we encourage them that if you can't read, let somebody read and explain things to you. So it makes you understand the things you do. And we've covered even with the medicine list also here, even though this is not comprehensive as we have it on the app. So that at least it gives you a guide that if people in the facilities are telling you that, they don't pay for this medicine, or they pay 10 cedis for this medicine, add 2 cedis to it, that is thievery. That is a breach of the contract we have with health insurance. We cannot allow it. We will not allow it if the facilities think that they can't work with the health insurance again. It is at their liberty to do what? To opt out. We want the services directly impacting life at the grassroots. You cannot. This is a social service. It is not really profit-making. And when service providers begin to make it, a profit-making venture, and the intent is not to give the people the impact of service that is deserving, but just to make profit, then of course we are going to have problems with them. So that myth, it's not a myth. We've actually been working across the country. In Tamale, some facilities are closed, some facilities are warned. In this district, we have already written queries to some 2 facilities already. They are yet to respond to those queries. I think this is one of the responses to those queries. I'm yet to review it with my superiors, and we will take the right decision. So that myth is not really a myth. It is there, but we are tackling it head on. Great. So as we get a lot of support from some other institutions, like I mentioned, UNICEF, the head office is constantly helping us to keep us on track. But they said as only the priest, you always want to ask for more. Our intent is to be able to cover, the district. And if you know, the Bawku West is very expansive, from Zongwiri to Sapelega, very, very expansive. And we think that if some logistics, like currently we have 3 motorbikes and a car, a brand new pickup. But if you look at our motorbikes are slightly worn out and really are not efficient. And so we are appealing to the general public. If you really want to help us to support the work that we do, we want to be in your community. And as a matter of fact, it is a policy of this district office and almost every district office around the country that we don't want to stay in the office. We think that, as I said, if somebody is supposed to register for a new car and it's 18 and above, it is 25 cedis. If the person wants to renew and it's 18 and above, it's 22 cedis. If the person is 17 and below, it's just 8 cedis. Now, the person should not be spending plenty money, 30 cedis, 25 cedis, coming to do said registrations. So it is when we get into the communities, then we cut the proximity, we make the proximity closer to them to be able to access. So motorbikes are a very important key. So all the stakeholders in the Bawku West district, we are encouraging them to support us with any help that they can. Motorbikes, you want to help us, we are very open to it. You want to help us in any way, we are really ready and open to it so that it can help our work move forward. But largely, we are doing very well. And we must also appreciate authority and the government of Ghana for providing us this edifice. If you were here 2 years ago, we didn't have this edifice. We were in a small building that couldn't contain all of us. But today we have very good offices, we have good furniture, we have good computers to be able to execute our work, and we are thankful. Okay. On the claims issue, we have 90 days to process your claims. So we are just ending, April will be ending today, and we expect that from the next few days, your claims for April should have been in. So when it comes, we have at least 90 days to be able to process those claims. And I'm telling you that 90 days is just for the goods, but trust me, sometimes within 30 days we are able to process those claims. But some of these facilities will wait, and they enter into the ensuing month, sometimes 2 months in arrears of bringing their claims. And when eventually they submit those 5 claims, they expect you, the officer, to now do the magic, to do the retrospect work that they didn't submit earlier and all that. But I think that there's now been a common platform. Initially, it used to be, claims vetted manually. Now we have what we call the Claimit, and that platform allows for all the facilities to be put on. They can immediately submit their claims electronically, and within real time, it reflects at the claim processing center, either in Tamale or any other part of the country, and then they begin to work at it. We have also, based on that, now improved on the payment system. If you go onto our website, you will see that you can check to know every facility and how much they are paid and for which month or which period they are paid. So that was also to cure this attempt by facilities that, we haven't been paid for 10 months, we haven't been paid for this month, all those lies and all those, things they do will no more, will suffice again, because we are tracking everything and we are trying as much as possible to improve our services better and better, all with the intention to make sure that the receiver of the service, who are our subscribers, get nothing but the best of service.